Gibson Kohli here with Snackable Health, and we're talking about coming down with COVID and when it's okay to return to work. President Biden announced yesterday that he's tested positive, and we see a lot of pictures of him working during this period. What do you think, Pyle? Is that something patients should be doing? Should they just keep on keeping on, or is it important to rest?
I think there's sort of two schools of thought here, Mike. One is the physicality of when is it okay physically to return to work, but the other is the mental stress. So, from physical perspective, how long are you still infectious? Well, you're probably infectious a couple of days before your symptoms started, and then about 5 to 7 days afterwards. Although we know that people can be infectious for up to 14 days total. So generally, I like to tell people to go back to work after they get a negative antigen test. That's one of those rapid at home tests. I don't usually recommend a PCR test for determining whether you're still infectious because even small amounts of viral fragments can leave that test positive, and that can sometimes stay positive for extended periods of time when you're not infectious. So that's my personal recommendation. The CDC says after 5 days, if your symptoms are getting better, you can return to work with a mask on. But I like to use that testing strategy just to be doubly sure in my patients. Now, mentally, the president is obviously soldiering on, and we need him to do what he does for all of us. But I do think it's a good idea because any kind of excess mental stress, not sleeping enough, can actually suppress your immune system and your immune response. So, if you have anything but an asymptomatic case of COVID, it's probably a good idea to turn down how much work you're doing, take a break, drink lots of water, make sure you get lots of rest, the usual things that we do when we get colds.
Now, 5 days is a number recommended by the CDC, but I think we've seen some recent data showing that there are a lot of people who are still positive after 5 days. What do you recommend in that scenario?
That's absolutely right. I mean, you're still positive after 5 days. You do daily tests until you come back negative, and don't just let one negative test be enough. Sometimes I like to confirm with another one a few hours later because as we're recovering, the sample collection, the way that we collect the test can also affect the result. So if you don't get a deep enough sample, you could get a false negative. So I usually like to have two negative tests before I, for example, would feel comfortable telling somebody to go near somebody else who might be at higher risk. And to your point, Mike, I just don't agree with that strategy of 5 days and everybody goes back because
Right.
the way the virus works in our body, the way it replicates, how much virus we have, how bad our symptoms were, which variant, all of that affects how long we're infectious.
They made a general recommendation, but that general recommendation may not be appropriate for everybody. So in this era of personalized medicine with all the testing we can do, I agree with you, Kyle. I think we should probably personalize it and really tailor people's return to work based upon how they and their body are doing. Thanks for joining us, and thanks to all of you for joining us out there for Snackable Health.